Hi, good evening, everyone. We all know that one of the most important organs that can get affected in diabetes are our precious eyes. During this World Diabetes Day Awareness Week, today we shall be discussing about diabetes and the eye. Next to the loss of life is the loss of sight is a famous old proverb which emphasizes the importance of eyesight particularly especially in people with diabetes. In India today we are over 100 million people with diabetes and all of them are at a risk of developing diabetic eye disorders. I am Dr. Rajlakshmi. I am the head of medical retina services at Dr. Mohan's Diabetes Specialty Center, Gopalapuram, and it's a pleasure interacting with you through this live program. And we are a team of 7 ophthalmologists at Dr. Mohan's Diabetes Specialty Center, and we take care of all the eye management of all the eye disorders at our center. Now, it's a pleasure for my colleagues to introduce themselves now.
Good evening. My name is Dr. V. Pratibha. I'm the Senior Consultant Ophthalmologist working in Gopalpuram Center in Chennai.
Good evening. I'm Dr. Geeta, Senior Consultant working in Dr. Mohan's Diabetes Specialty Center, Coimbatore.
Hi, I am Dr. Bala, Senior Consultant Ophthalmologist in Dr. Mohan's Diabetes Specialty Center, Ananagar.
Hi, good evening, everyone. I'm Dr. Karimuddin. I'm taking care of the Domalguda branch in Hyderabad of the Dr. Mohan's Diabetes Specialty Center.
Hi everyone, this is Dr. Arun Malal here. I'm the Senior Consultant Ophthalmologist in our Gopalapuram branch. Nice meeting you.
So now let's move on to the discussion about the impact of eyes. So, hi Dr. Pratibha. What are the common eye disorders that can affect people with diabetes? Please say
Good
a few
evening.
words about it.
Eye disorders are more common in diabetic individuals than in non-diabetics. All parts of the eye are usually involved in diabetic patients. The most important eye disorders seen are cataract, diabetic retinopathy, and glaucoma. Externally, as we consider, in the lid, we can get swellings like stye and chalazion. The white part of the eye, this is the white part of the eye called the conjunctiva. In diabetic patients, conjunctivitis is very common. It can be both infectious as well as allergic type. The next important part is the lens. Here the lens is placed. Normally the lens is transparent, but in patients who have cataract, there will be a clouding of the lens. The lens is an important part of the eye which helps to focus the light. In patients who have cataract, there will be also blurring of vision and also increased glare, especially during night driving. Glaucoma is another very important condition which we see in diabetic patients. In glaucoma, there is a damage of the optic nerve, which is the main nerve which is found at the back of the eye. This is the eye model and this is the optic nerve. The most important problem which can occur in diabetic individuals is diabetic retinopathy. This is the orangish portion of the eye, the innermost part of the eye is called the retina. The retina is the nerve tissue of the eye and it causes the light sensitive layer of the eye. Whenever we have high blood sugar, it can affect the small blood vessels of the retina and cause diabetic retinopathy. Long duration of diabetes and uncontrolled diabetes are the important risk factors. These are some of the images of diabetic retinopathy. These are sight-threatening bleeding inside the eye. This picture, and this shows macular edema. Apart from this, we also have other problems like nerve palsies. Thank you.
Thanks, Dr. Pratibha. That was a very nice introduction. So the next topic is what are the complaints that a person with a diabetic retinopathy will have? So generally, patients with diabetic retinopathy, they remain asymptomatic for a long time. In the initial stages, mild, moderate, they remain asymptomatic. There won't be any signs or symptoms outside, but when we examine, we can see the changes in the retina. Only when they go to the late stages, that is the sight-threatening stages, vision loss will be there. When should he or she go to the eye doctor? all diabetic patients, once they are diagnosed, they should visit retina clinic once in a year at least, in order to thoroughly check the retina to diagnose diabetic retinopathy. In our setup, it's a very unique setup where, along with eye examination, we have access to the diabetes, so that regular follow-up and good control can be taken care simultaneously, and this can help in the prevention of sight-threatening stages, which comes later. So next question is to dear Dr. Kannan Bala. One of my patients having diabetes for 10 years, a young lady, about 35 years old, has mild to moderate diabetic retinopathy changes on retinal examination. What would be your advice for her, Dr. Bala?
Thank you, Dr. Geeta. So the mild and the moderate stages of diabetic retinopathy is reversible actually. And this is possible with the strict control of blood sugar levels, as well as a frequent and regular follow-up with an ophthalmologist. And in a moderate stage, the follow-up should be every 6 months. So try to maintain the HbA1c levels. HbA1c levels less than 7, and also the associated systemic gut parameters like blood pressure and cholesterol has to be maintained within the normal limits. And we have eye clinics in all branches of Dr. Mohan's. So once you are diagnosed with the onset of diabetic retinopathy, get the diabetologist help to control the sugar levels and the ophthalmologist hand to check for the progression or the worsening of diabetic retinopathy. So we cannot control or arrest the progression of diabetic eye damage by using eye drops or eye ointment or taking tablets. The only way is to control the blood sugar levels and to have a frequent follow. Thank you.
Thanks for the wonderful explanation, Dr. Kannan
Geeta,
Bala.
we have some questions here. We have a person who has asked us if diabetic retinopathy can be cured. So diabetes and diabetic retinopathy, we are basically keeping it under good control, it by systemic control, as Dr. Kannan Bala rightly mentioned. And there are patients who have sight-threatening retinopathy, like what Dr. Pratibha showed. Such patients may require laser photocoagulation treatment, injections which are given in the eye. These can help to maintain good vision lifelong. And they may not have any symptoms. That's the main thing. Somebody has asked if there would be any symptoms. The patients very often, only in the late stages, they may have floaters, flashes, they may experience some black spots if they have bleeding or blurring of vision, etc. So that answers. And Dr. Bala, there is a question here where Mr. Raghav Sharma has asked that he is using a system for long hours as a designer. So he wants some advice regarding prolonged hours of use of system.
Yeah, it's true that irrespective of age, profession, we all spend a lot of time with the electronic gadgets. So if the screen time is going to be more than 2 hours a day, there's every possibility for all of us to develop dry eyes. And eyes become dry, irritable. At times we can have a red eye and mild blurred vision, congestion, and all this are symptoms of dry eyes. So what happens is when the tears what is secreted in the eye is not being effectively spread over the entire eye, since the blinking rate comes down, we keep staring at the monitor or the mobile phones, the blinking rate comes down, and this is the reason why we land up in dry eyes. So the remedy will be 20-20-20. That is every 20 minutes, try to look at an object at about a 20 feet distance for at least 20 seconds. So you can either look at a tree through a window, or you can hang a calendar or any picture in your workplace. If all this is not possible, just every 20 minutes, try to close your eyes, count 1 to 20, then you can open your eyes and continue doing your work. In case you are becoming symptomatic and your eyes are bothering, then you need to consult an ophthalmologist and start using drops, lubricant eye drops, which are nothing but tear substitute. So once you start using tear substitute, you will get a symptomatic relief, sir.
Thanks, Dr. Bala. So next we proceed to the next question. Hi, Dr. Karim. Many aged people develop cataract, and can people with diabetes undergo cataract surgery? What precautions should they take?
Yeah, thank you, ma'am. This is a common question I face in the clinic too. Any patient who is having cataract can definitely undergo cataract. who is also a diabetic can undergo cataract surgery once his sugar is brought under control. Without good diabetic control, cataract surgery is not suggested. Second thing is, before going for cataract surgery, it is mandatory. We need to thoroughly check our retina, whether there are any, what is the condition of retina, whether there are any sight-threatening problems like fluid accumulation in the central area or blood over the retina, bleeding into the retina, which if not taken care of before going for surgery leads to aggravation of the problem. So two things, one is good diabetic control and we have to thoroughly check the retina. At our center, in Gopalapuram center, we have the facility for controlling the blood sugars and then taking up for the cataract surgery. So whoever patients are refractory and are not able to control their sugars and postponing their cataract surgery can definitely come over to our Gopalapuram center, get admitted and control sugars and undergo the cataract surgery. Thank you.
Thank you, Dr. Karim. That was a good explanation for the needed patients. Dear Dr. Usha, other than blood sugar control, we do advise laser treatment for our patients who have vision-threatening diabetic retinopathy in order to safeguard their vision and prevent bleeding in the eye. Can you please explain about this?
Yes, Dr. Geeta, thank you so much. Actually, the treatment part for the treatment is specific treatment is not for all the diabetic retinopathy cases. We need to assess properly and to look for any sight-threatening cases only will require specific treatment like laser. Many will think that laser is like a surgery or operation. It is not so. It is a very simple procedure, painless procedure and outpatient procedure. Very easily it can be done and patient will not have a much discomfort. And it is a very important thing. We need to do the laser so that we do for two conditions in the diabetic retinopathy. One is fluid accumulation in the retina. The other one is if there is any bleeding. We need to do laser for all these two conditions. So once it is done, definitely patient will have better, the progression of the diabetic retinopathy will be stopped and definitely they'll improve with the vision and it is very important to do the laser. That is how it is done.
Thank you, Dr. Usha. That cleared the doubt. Hi, Dr. Arul Malar. Today, one of my patients who is an IT professional came back for review after receiving intravitreal injection for retinal swelling in the central vision area. And his vision has improved very well after receiving the injection. And he's very happy about it. He's able to work in the system like before clearly. He said that he never knew about this procedure at all. Can you explain a bit more for our audience regarding the injections given in the eye, please?
Yeah. Thank you, Dr. Geeta. So mainly what happens in diabetic macular edema is there will be fluid collection in the central portion of the eye. So the patient will have a drop in vision. This can be treated, various injections are available, which are done as an OP procedure, which injections are given in the white portion of the eye. It's an OP procedure only. It can be done in a few minutes. They give excellent results. It reduces the swelling in the center, so the patient's vision improves. So a lot of injections are available. Depending on what type of injection we give, the patient may need, some patients may need repeated injections. That's the only problem. But otherwise, it's a very excellent drugs are available for injections, which will improve the patient's vision as well as quality of life. Yeah, thank you.
Thank you, Dr. Arul Malar. That was a very good explanation. I hope they have understood very well.
And now from Mrs. Malati Ravindran, she has asked what is the basic test for diabetic retinopathy. Geeta, so to explain to Mrs. Malati, what do we do at our center? We basically do a dilated examination, whereas very often patients do only their glass checkup outside. But whereas we have to do a proper, complete, comprehensive eye examination in people with diabetes for detection of retinopathy. So we check the vision, we check the eye pressure, We examine the front of the eye to check for cataract. Then we dilate it for a complete eye check examination. A retinal color photography. We take photographs of the back of the eye. A retinal color photography is a good alternate for retinal examination by a retina specialist. It's good for all people with diabetes to meet a retina specialist. And I think Mrs. Malati, your question, how to prevent complications, was answered by Dr. Bala. Again, targeting and maintaining your HbA1c for people with diabetes less than 7, keeping the blood pressure and the serum cholesterol under good control, and having a regular monitoring eye examination is essential. Good follow-up with the diabetes doctor as well as the ophthalmologist. And we have again another question by Mr. Shankar Babu. Whether age can be a reason for sight problem? Geeta, would you like to answer this?
Age, is it regarding the diabetes, Dr. Raji? He's
No,
asking.
age-related macular degeneration, cataract, these all occur with senility.
Yeah, there could be many. There could be many reasons, starting from the front layer of the eye to the back part, which can cause vision problems. The commonest thing is the refractive error, where the distance vision, the myopia is the commonest thing we see. So they won't be able to see clearly at the distance. So we wear glasses for that. It's the commonest thing. But with aging process, cataract can happen. So this also can cause vision loss. So for the treatment is to do surgery for that. Then coming with to the back part, retinal problems can cause vision problem, like bleeding, fluid accumulation in the central area of the back part of the eye called retina, which our colleagues had explained to you. So these are some of the reasons. And going back still, optic nerve involvement due to diabetes, hypertension, ischemic factors, all these things can contribute to sudden vision loss also. Then vein occlusions can happen. It's a combination effect of diabetes, hypertension, dyslipidemia. So these are all acute conditions, can be suddenly result in eyesight problem. So there are many reasons. Only a complete examination of the eye, we can find out what is the reason. So right from younger age till the older age, there are many reasons for which vision problem can happen, and there is cure for all these problems. We can always identify and treat them early.
I guess meeting the ophthalmologist regularly, all these problems can be addressed in time. Very aptly expressed, Dr. Geeta. And Mr. Raghav Sharma has a question regarding screen time. See, we have screen time related to office work, people who are IT professionals or chartered accountants. Many of us many of them work for at least 8 hours, minimum 8 hours a day on their system. So, but for personal use, like using social media, WhatsApp and things like that, also we keep seeing the mobile, etc. So, ensuring that for personal use, screen time doesn't extend beyond 2 hours per day, because it's already 8 hours per day for work. Ensure that it doesn't extend beyond 10 hours per day, ideally. Okay. And thanks for the interest. And I see that a lot of questions are pouring in the chat box. And there are, what food can be consumed to improve the eyesight? Geeta, this is one more question for you. And food can be consumed.
So food, coming to the food, regarding with the young children, we should promote beta carotene for increased levels of beta carotene. Yellow pigmented vegetables, fruits, they all will help in absorption. So it's very essential for children, vitamin A. So fruits, vegetables should be encouraged for at the level of for all children in their younger years to be consumed regularly. Particularly when we become with aging, age-related macular degenerations or a type of retinal disorder which happen in the central area of the central area of the retina, where it will cause vision loss gradually. So in such circumstances, antioxidants are needed. So in the diet, like in the vegetarian diet, milk, nuts, legumes, pulses, and then plenty of green leaves. These all are suitable for diabetic patients also. They can take. They all have good amount of antioxidants in it. In the non-vegetarian, eggs, poultry, and then fish, they all have good amount of antioxidants which help in these conditions. So generally vitamin B12 is important for the optic neuropathy related things. If the vitamin B12 is reduced, or if in the system it is of lesser quantity, it can promote, it can give rise to optic neuropathy in some cases. So vitamin B12 supplementation, it is plenty present in non-vegetarian diet. For vegetarians, periodical injections can be given.
To add to
So,
what you just told now, one small thing is we did a study at Dr. Mohan Center where we found that if there is vitamin D deficiency, it increases the risk of bleeding by twice. That is, people who have vitamin D deficiency are twice at higher risk for developing bleeding in the retina. So vitamin D deficiency also should not be there. Nowadays, many people are just indoors, so with vitamin D deficiency. So vitamin D is equally important like vitamin A, B, as etc. Like what Dr. Geeta rightly explained, because of the antioxidant and anti-inflammatory properties of vitamin D. So we have a question from by Mr. Raja Mohammed. He has asked, he has mentioned that his father has undergone cataract surgery and now he feels blurring of vision. So what should his father do? What would you be your advice for him, Dr. Pratibha?
Yeah, we have to first wait for about 1.5 months after the cataract surgery and give anti-inflammatory drops and also steroid drops. After to reassess the vision, it's very important to do an OCT, optical coherence tomography, that will give the exact picture. It depends upon the amount of macular thickness. If the thickness is very excessive, then intravitreal injections have to be given, and if the center area of the fovea that is involved, then intravitreal injection should be given. If the thickness is less, then laser treatment can be done. Along with that, good sugar control is also very important. Thank you.
Dr. Kareem from Mrs. Valli, and she says that the person, she is having a problem in the retina due to diabetes. So she wants to know that for diabetes control, normally they say diet, exercise, etc. is important. So she wants to know if she can do exercise in the gym or do yoga exercises, etc. Your Kareem, what would be your advice for Mrs. Valli?
Yeah. Actually, for a patient who is having proliferative diabetic retinopathy or who has undergone recent laser treatment for proliferative diabetic retinopathy, there will be already new blood vessels in the retina which are very fragile. So these patients are preferably, if they avoid strenuous exercise, that will be good. In the sense, no weightlifting. Patient should see that there is no constipation, and there should be he should avoid strenuous yoga procedures like Shasana and all. Normal walking and lighter modes of exercise are they can do, but strenuous exercise and lifting weights in the gym, that and all should be restricted, so that leads to further bleeding into the retina, and that will lead to loss of vision.
Best, Kareem, and I think people who have retina problems, they should take care, follow the advice of the ophthalmologist, and they should also probably inform their gym trainer or their yoga trainer regarding their eye problems before they start doing such exercises. Yeah. Geeta, there is a question also regarding retinitis pigmentosa, etc. And Dr. Arul Malar, there is a question about viral conjunctivitis. Now there is a epidemic of viral conjunctivitis. A patient says that after cataract surgery he is getting viral conjunctivitis. So what can we do? What can we advise such patients who get viral conjunctivitis?
First thing is, do not self-medicate. First, go to an ophthalmologist and have your eyes checked, and maintain hand hygiene. Don't touch your eye, and if you have an infection in one eye and you touch the other eye, that eye also may get infected. and complete hand hygiene. Don't use common things like towels. Don't give it to your family members; they may also get it. Uh, and more all even cutlery or spoons, whatever you're using, if they also use and if they touch their eyes, they are going. So I'll ask everyone to maintain hand hygiene. And if someone is putting drops for you already, after putting the drops, ask them to wash their hands pretty well. um, and mostly avoiding touching your eye will reduce your chances of infection. Over to you, Dr. Geeta.
The next question is, hospital has 50 branches, and we are screening all our patients who come for diabetes checkup for diabetic retinopathy through teleophthalmology. I think this is a great technological boon benefiting patients. What are your thoughts about this, Dr. Pratibha? Can you tell us a few things about this?
Yeah, teleophthalmology is a very important branch of telemedicine. With the help of digital fundus camera and also with telecommunication facilities available now, we can provide quality ocular care to more and more people. In our all 50 branches, we take retinal color images by the optometrist with the help of smart phone fundus camera, and these ocular images, retinal images, are then graded by the ophthalmologist after being remotely transferred. If the patient has no diabetic retinopathy, we advise them to come for a follow-up, periodic follow-up. In the early reversible stages of diabetic retinopathy, we ask them to come to have better glycemic control and also risk factor control. Only those patients who have vision threatening problems, like if they have bleeding inside the eye or if there's fluid accumulation in the center area, we request the patients to come to our main hospitals where doctors are available, and then we do appropriate investigations, and then we treat the patients. We have found that all the patients greatly appreciate these services as it decreases the traveling time. It's very cost effective, and also it helps to in early detection of vision threatening complications and helps to prevent blindness. Thank you.
It has been the vision of Dr. Mohan and Dr. Amma Mohan to ensure that every person with diabetes who comes to our center has an eye checkup, and so nicely explained regarding teleophthalmology, Dr. Pratibha.
So the next question is to Dr. Bala. I went to the opticals recently for glasses checkup. One of the patient is asking this. I went to the opticals recently for glasses checkup 6 months back, and my vision is fine with my present glasses. But my diabetes doctor says that I should undergo an eye examination. Why should I?
See, what is being done in the opticals is power testing. So from the age of 35, we all develop near vision issues. So we need to go to the opticals, get a power testing and start using glasses for reading. But when you have diabetes, what is recommended is you should get a dilated retinal examination done by an ophthalmologist. See, retina is the innermost layer of the eye. So you cannot see the retina without dilatation. We can visualize the retina. We need to apply dilatation drops and then see the retina to find out whether there is any diabetic eye damage. So once you have diabetes, plan for a dilated fundus examination with the ophthalmologist. And if at all you are going to have any diabetic eye changes, then you need to have a proper follow-up. So going to the opticals is not going to help out to see a diabetic eye damage.
Thank you, Dr. Bala.
Now there's a question for you, Dr. Geeta. There is a question again, whether any eye drops can be used to prevent diabetic retinopathy. There are a lot of innovations. Are there any specific eye drops? Many of our patients ask us, no, whether are there any drops available?
Till now, there is no confirmatory or a diagnostic thing which gives result where such eye drops are not yet available. The best way how to control diabetic retinopathy is by perfect, systematic, consistent control of your diabetic levels, because the diabetic retinopathy happens in the damages happen in the blood vessels. It depends on your blood sugar level. So if you are able to manage the blood sugar level right from the starting of the disease stage, and if you are able to consistently maintain around 7.5 throughout, then you will be dragging the onset of diabetic retinopathy. In that way, you will see that these changes don't even start, and you can postpone it for many more years, so that you at the with more increasing number of years, the sight threatening stages won't come at all. You will be having a very good vision, and this is how you can prevent diabetic retinopathy. But the drops, till now it is not available, but this is a 100% foolproof method where it will work out for you.
When there is some swelling in the retina, in the center vision area, at times we can, of course, give drops like Nepafenac eye drops or Bromfenac eye drops are tried at times, but it depends. Some patients do benefit, but majority of them, essentially, as you rightly said, the key is glycemic control, good glycemic control right from the beginning. Thank you, Dr. Geeta. That was an excellent answer. I think you have emphasized the importance of diabetes eye care. And there is a question regarding what is the care for post-COVID patients with respect to the eye. Do you would you like to answer, Dr. Arulmalai?
Yeah, post-COVID conjunctivitis has been happening, and mostly post-COVID diabetes per se is also happening. So, eye check post-COVID. Sometimes you are more prone for thrombotic phenomenon also. So, retinal check and full eye check will be better. A post-COVID examination, checking your vision, checking your retina, if you have any vein occlusions or any other, because COVID literally affects almost everywhere. So we need to have a complete thorough eye check post COVID will be better.
Yeah, thank you. As you said, we saw a lot of retinal vein occlusions at the time when we had active COVID. We saw a lot of such infections. Plus, so COVID, post-COVID, more increase in diabetes as well as diabetes eye complications. Thank you. And we have a question on glaucoma, Dr. Pratibha. Can glaucoma be controlled with eye drops in the first stage, Dr. Pratibha?
Yeah. So glaucoma is a silent disease and it can cause irreversible blindness in the late stages. So in the early stages, once glaucoma affects the eye, those nerve fibers cannot be regenerated. So it only further damage can be prevented. So all patients who are more than 40 years of age, who have a family history of glaucoma, should have a visual field analysis called automated perimetry done, so that we can pick up the glaucoma in the early stages itself. Because once glaucoma affects the nerve fibers of the optic nerve, new fibers will not be regenerated and we can only prevent the further loss. So once in the early stages, we can give eye drops. Now a lot of latest eye drops are available, which are once daily. So this helps in the increase in the compliance of the patient. And also we should come for proper follow-up. Periodic, every 6 months, visual field analysis has to be done to see whether the drops are effective, the treatment is effective. We also have the eye scan, that is the optical coherence tomography. So this also shows about the nerve fiber layer in the retina and whether in the future, whether there's any chance of developing glaucoma, especially in patients who have a family history of glaucoma, is very helpful. Only in the later stages, glaucoma surgery will be required. Thank you.
Maria Fernandez, who has asked how we can be contacted for an eye checkup and where. You can see the display of the number for contacting for appointments. You can and the email address also, which is getting displayed down in the screen, bottom of the screen, Mrs. Maria Fernandez. You can call this phone number which is mentioned here below, or you can also write an email to fix an appointment. We would be happy to examine you and provide further suitable advice.
So the next question is for Dr. Usha. When should first eye checkup be done for young children?
Generally, at the school going time, it is definitely the visual demand will become more. So it's better to subject them to the eye test at the school entry. But if they have any complaints, like from the parents will definitely will pick it up. If the patient, I mean the child has any squint in the eye or is going very close to the TV and watching, then definitely they have to be subject to the eye checkup. They may have some myopia or hypermetropia, which has to be tested. So general at the school entry, definitely they have to undergo a eye testing.
Can you tell some little more about amblyopia, Dr. Usha?
Yeah. Okay. Actually, when there is a refractive error in the child, which is not corrected, then what will happen is the optic nerve will go in for a lazy eye condition. Because what happens actually is when the refractive error is uncorrected, whatever the light has to go and fall on the retina will be prevented because of the refractive error. So what will happen? The optic nerve will go in for a lazy eye condition. So this has to be corrected within the age of 8 years. So that is very important. But once it goes away after 8 years, even if we correct it with the correct glasses, the patient may not improve vision. That is because of this lazy eye condition of the retina. So we need to correct it at the age of 8 itself. That only we call it amblyopia. But the retina will look normal inside. Only the functional aspect of the retina will go up. That is why we call it amblyopia.
Thank you, Dr. Usha. That was a very nice explanation. This is the question to Dr. Pratibha. I recall one of your patients came with a sudden double vision complaint. How is he now? Can you explain about his condition, Dr. Pratibha?
Yeah. This patient had come with sudden double vision, and on ophthalmic examination, we had, along with double vision, he had also had a partial drooping of his eyelid, and his eye was also outward turned. So it was diagnosed as third nerve palsy. For the eye movements, we require three main nerves which come from the brain: the third nerve, the fourth nerve, and the sixth nerve. If any of them are affected, there's a decreased strength to the muscle, and so there is a decrease in the movement of the eyeball in that particular direction, which has been paralyzed by the muscle. In this patient with the third nerve palsy, he had that is called an oculomotor nerve palsy. Treatment will first consist of getting a good sugar control, and secondly, we should also have, because he's having double vision, we should also can suggest intermittent occlusion. That is, we can occlude the eye for short periods of time when he's walking out, going out. So this will prevent the double vision. And also very important is we have to also do a complete neurological evaluation, whether a pupil is involved or not, whether he's having any body paralysis. If such problems are there, we have to get an emergency neurologist consultation, do an MRI of the brain, and see if there's any stroke present or any hemorrhage is present or not. The other problems which can occur are the fourth nerve and the sixth nerve. In fourth nerve, very classical sign is the patient will have double vision when he's looking down, especially when he's walking down the stairs. He will say he has double vision. It's a very classical symptom for fourth nerve patients. And sixth nerve is the most common nerve, that is the abducent nerve. These patients will also have double vision, and it will be turned outwards. The eye will be turned inwards because the eye cannot move outwards. For all these nerve palsies, it's very important to keep good sugar control. And along with that, any neurological sign should be seen. If there's any other paralysis of the contralateral part of the body, then immediately neuro consultation should also be done. If there's no neuro problem and only due to diabetes, then we should reassure the patient that in 1 to 3 months, the nerve palsy will slowly regress and become all right. He should come for periodic evaluation of the eye. And slowly we have seen that most of the patients, if they have, it's only because of diabetes, ischemic reasons because of diabetes, he will get the double vision will recover completely. Thank you.
Thank you, Dr. Pratibha. That explains.
And Geeta, very often my patients keep asking me, can I do some exercises, eye exercises to improve my vision? they are in the yoga classes, they teach me some exercises. So they want to know if the exercises which are being taught, are they good? What kind of exercises would you generally suggest for the general eye public? It's not related to diabetes. In general, can they do eye exercises?
Yes, this is a common question asked by all general public when they come to our clinic. So we can do eye exercises which they teach you in the yoga. It's just basic movement, upward movement, downward movement of the eyeball, then towards your sides, clockwise rotation, anti-clockwise rotation. All these things anyone can do. It generally helps in the muscle stability of the eye muscles. The muscles will be surrounded in the eyeball. It will help in the stability of those muscles, well-being of those muscles. And also for someone who is involved with near work, like children reading for long hours during their board exams, they are occupied with more than 10 to 16 hours, and then also IT professionals when they are involved more than 10 hours. So generally they have muscle fatigue, convergence. They'll always be converging. Their eyes will be always be converging. So convergence muscle fatigue will be there. So they, as Dr. Bala said, they can relax, look at a distant object. They can distract themselves for about few minutes outside, go out so that the muscles can relax, and then they come back and do their work. Also, there is an exercise where you can extend the index finger to in front of you, and this is called the convergence exercise, and then bring it towards your tip of nose and look at it till the double vision happens. Do this several times. This also will be helpful for you when you are engaged in such when you are involved for long hours of near work. All these things will help in the well-being of the eye muscles.
Geeta, I think you have very nicely explained, because a lot of patients keep asking about these eye exercises very frequently. Very aptly explained by you. See, some of our patients, Dr. Bala, we have a question from Mrs. Valli Kumar, where she has asked regarding the whether the blood sugar needs to be tested before doing a glass power testing. So, what do you generally advise for your patients, Dr. Bala?
So for a diabetic patient to undergo refraction glasses testing, first check the blood sugar levels. The postprandial blood sugar level should be below 200, and or the HbA1c 3 months average should be at least less than 8. So the reason is when the sugars are on the higher side or on the lower side, hyperglycemic as well as hypoglycemic status, the size and the shape of the natural lens changes. The lens becomes either swollen or shrunken based on the glycemic status. So when the patient goes for a glasses testing, when the sugar levels are on the higher side and they get new glasses and they get expensive glasses, then the blood sugar comes under control. They may not be comfortable with the new glasses. So advice will be, before planning for a glasses testing, check the postprandial sugar levels, either the HbA1c below 8 or the PP sugar levels at least below 200. Maximum should be 200. Then if they go for a glasses testing, the power, whatever is being checked there in the opticals, will be a accurate power. Otherwise, it will only be approximate power and may not be of much help for the patient.
Yeah, thank you for this nice explanation. Many Dr. Usha, very often our patients, after they undergo laser, they think that laser is like a one-time procedure like cataract surgery. They think, okay, I've undergone laser, and sometimes they miss their follow-ups, because of which they again land up with some bleeding and vision drop in their eye. How frequently do you normally advise follow-up for patients who have undergone laser for bleeding in the retina?
Yes, Dr. Raji. This usually it happens. Many of the patients, they undergo laser, then they think that the treatment is over lifelong, and they don't come for the review at all. One fine day, they just end up with very severe complications further, and they come with a very poor vision. So this is what they have to know, that it has to be done periodically, lifelong. The examination of the retina is very important in any diabetic patients. Even after the laser, it can worsen. The diabetic retinopathy can worsen if there are any risk factors and the diabetic control is not proper. the progression of the active retinopathy can occur, and it can produce complications like further bleed can come, or it can pull the retina, and very serious complications can occur. So they have to undergo a review. They have to come for the review, which is important. And depending upon the stage in which they are seen last, the ophthalmologist will tell exactly when to come, whether it is a 3 months review, immediate post laser, or after 6 months. Like that, you have to keep on viewing the retina periodically, which is very important, and people should know about that.
Thank you. I think essentially, at least every the patients who have undergone treatment for the diabetic retinopathy problems, at least every 3 months, they should to 6 months, they should definitely meet their ophthalmologist to be sure if the eye has settled down and eye is quiet post laser. We have a question from Ms. Bonita. There is a request where she says a person cannot come to the center for an eye checkup. Can home visit be arranged? Thank you. I just wish to mention that Dr. Mohan's Diabetes Specialty Center is planning to start home care retinal photography also for patients who can't come to the hospital. Retinal photography will be taken at the home along with blood test. Retinal photo, they'll use special fundus cameras about which Dr. Pratibha was mentioning earlier. They'll be using such cameras, come to their home for the very aged patients. Please contact the number mentioned below, or you can write an email to this program will be definitely is going to be started shortly as a part of the World Diabetes Day events. We are going to start home care retinal photography also. Thanks for your question, Ms. Bonita. There is a question about diabetic retinopathy and glaucoma being present simultaneously, Dr. Pratibha. Would you like to explain about this?
Yeah, both diabetic retinopathy and glaucoma are not interrelated. Glaucoma is seen in there's a more chance of developing glaucoma in diabetic patients. That is some of the studies which have shown. Diabetic retinopathy usually because of the high blood sugar, it affects the small blood vessels in the retina. In the early stages, it is silent, and in the later stages, as it always told, it can cause either bleeding or it can cause fluid accumulation. In glaucoma, the back of the eye, there is something called the optic nerve. So that gets involved. One of the commonest reasons is the increased intraocular pressure. If both are present with the patient, then it will be very difficult. Though treatment is available both for glaucoma as well as diabetic retinopathy, it will be very difficult for the patient, and proper management and follow-up will be required. They both are not related. Thank you.
Sometimes very severe diabetic retinopathy, the advanced stages of diabetic retinopathy, we may have something called neovascular glaucoma also, but that we should never let the patients progress to that stage. If a timely eye examination and laser is done, we can prevent neovascular glaucoma, which can be a very painful blinding problem. So I think essential key is regular eye examination is key.
Secondary glaucoma is usually unilateral. Mostly it will be seen only in one eye, while glaucoma, generally open angle glaucoma, is seen bilateral. So it's a very important point.
So essentially, what we all are people with or without diabetes, 40 plus, there are some conditions like glaucoma, cataract, glasses, refractive error. So every person has to have an eye examination done on a regular basis, not just undergo a glass power testing alone. Because glass power testing, sometimes if glaucoma is present, it can get missed because glaucoma is a silent thief. Diabetic retinopathy is also a silent thief. So ensuring that irrespective of whether you have any ocular complaints or not, please visit your nearby ophthalmologist, particularly more so if you have diabetes. We had a person who was asking regarding using screen after having diagnosed with type 1 diabetes and use of screen time, etc. Screen time has to be reduced irrespective of diabetes for all of us, because dry eyes are more common in people with diabetes than people without diabetes. So if the screen time is longer, it will tend to increase the dryness in the eyes. Again, if the person has thyroid dysfunction also, it can cause worsening of the dry eyes. So that is essential to remember that screen time should be reduced. All people with diabetes, irrespective of the type of diabetes, it is possibly important to have a regular retinal examination done at least once a year, so that they can, even if there are any complications, either by photography or by a dilated eye examination by retina specialists, you can pick up diabetic retinopathy early, give a timely treatment, keep the blood. I think diabetic retinopathy management and diabetes management should go hand in hand. It is not that one can be done, the other cannot be seen. Some patients just focus on sometimes foot problems and they miss the eye checkup sometimes. So I think the eye checkup and the management of all other complications in people with diabetes needs to go hand in hand. At Dr. Mohan's Diabetes Specialty Center, the fortunate good thing is that we have everything under one roof. The screening and treatment of all complications is available at our center under one roof. You need not go separately to an eye doctor. You need not go separately to a kidney doctor or a foot surgeon separately. Everything is done, all care of all complications, microvascular, basically diabetes affects the blood vessels in different parts of the body. So ensure that you have basically your eye examination done regularly, at least once a year if you have diabetes. Dr. Bala, I would like to ask you one question. I say there are people with type 1 diabetes or type 2 diabetes during their pregnancy times. What would you advise for such patients if they are pregnant? Should they have their eye checkup done? What is the frequency in which you see such patients who are pregnant, people with type 1 or type 2 diabetes who are pregnant?
See, either the pregnant patient can have diabetes before the pregnancy period or during the pregnancy period, which we call it as gestational diabetes. So what happens is the tight blood sugar, what they maintain before the conception period, the fluctuating sugar levels, and at times the hormonal impact. So the hormones which are required for the growth of the baby can aggravate a diabetic eye damage also. The retinopathy changes. One cause is the hormonal changes which happens for the development of the baby. So in case the patient does not have a diabetic retinopathy either before pregnancy or during the first trimester of pregnancy, we can advise a follow-up annual checkup once a year. And in case the patient has got a moderate diabetic retinopathy during pregnancy in the first trimester, advice will be once in 6 months. And if it's going to be severe, every 3 months. Every trimester, patient has to undergo a dilated retinal examination in case the patient is having a severe diabetic retinopathy to closely monitor the progression to a proliferative diabetic retinopathy. And we have seen patients with proliferative diabetic retinopathy, and that too during the last trimester, where we have done a laser before the patient goes in for a labor to prevent a bleeding during a normal delivery. And in case at the time of delivery or very close to the due date, we find that the patient has developed a proliferative diabetic retinopathy, that is developing a bleeding stage, bleeding risk in the eye, then we do advise a cesarean section to prevent a bleeding inside the eye when the patient goes in for a normal labor. So after delivery, they have to come for a regular follow-up for a dilated retinal examination and treatment if required. So this will be the advice for diabetic retinopathy during pregnancy.
Very aptly said. And again, laser photocoagulation, which is required during bleeding in the eye, is not contraindicated during pregnancy. It doesn't affect the fetus. It is a locally acting laser. It will not harm the mother or the fetus in any way. So laser treatment can be done during pregnancy also. And so that and as you rightly said, even after delivery, they have to have their retinal examination done regularly. Thanks, Dr. Bala.
Dr. Raji, I would like to ask you this. Can you please explain about the relation between the diabetic retinopathy and the diabetic nephropathy? Because we always get patients from them saying that they have urea creatinine is increased, nephropathy is there. So they would like to look at the retina. What relation is it? Can you just explain?
Thanks, Dr. Usha. Basically, diabetic kidney disease and diabetic retinopathy are microvascular complications. That is, they affect the small blood vessels. In the eyes, the small blood vessels in the retina get affected. And in kidney also, the small blood vessels get affected. Here, the exact mechanism how kidney damage occurs and the mechanism how retina damage occurs is very similar. They carry a similar pathogenesis. So, usually when they have kidney problems, they are more likely to have eye problems. So, if suppose the person is having protein excretion in the urine or the urea creatinine levels are higher side, it is very essential for them to have their eyes immediately screened. Very often we have our diabetologists who refer the patients to us when the patient is having proteinuria. They will tell us if the protein is getting excreted. They will immediately emphasize and send our patients for a retina checkup immediately. Because again, control for these microvascular complications, there can be more incidence of swelling in the retina in people who have kidney problems. That is, macular edema or swelling in the central vision area is more common. So even patients, just as when kidney disease progresses, the retinopathy can also progress. Control of hypertension here becomes a very important role in patients who have diabetic kidney disease and eye disease. Okay, thank you, doctor. And anemia can also occur sometimes due to kidney disease, and that can cause worsening of retinopathy, and multiple red spots can occur in the retina due to anemia secondary to kidney disease also. Thanks, Dr. Usha.
Thank you, Dr. Raj.
Dr. Raji, can you tell us the importance of hypertension control, lipid control with respect to diabetic retinopathy also? Because
Yes.
most of the time we see all these three things together in a patient. So what's the importance of these things?
I think Dr. Mohan always talks about ABC control to prevent complications. A refers to HbA1c, that is HbA1c less than 7. B refers to the blood pressure control. Targeting and maintaining blood pressure less than 130/80 becomes important, particularly if they have kidney disease and eye disease, retinopathy, 130/80. And cholesterol control. Overall, particularly the low density lipoprotein cholesterol, that is the bad cholesterol, which we call the LDL cholesterol, that should be maintained less than 100. So these, of course, have to be individualized, but maintaining like this, particularly we have seen patients who have lot of fat deposits in the central vision area of retina. Sometimes when the cholesterol levels come under control, we see that next time when we examine those patients, after the fat deposits which are there in the central vision area of retina disappear after good lipid control also. And ABC control, which Dr. Mohan always emphasizes in his talks, I think that is the key in management of retinopathy also. Is key. Active participation, I think from all the audience today, we had a very active participation from all the audience. The key take-home message is ensure that you have your eyes checked up on an annual basis if you have diabetes. Keep the blood sugar and blood pressure under good control. Retinopathy is a silent problem. It does not produce any symptoms for you to know that you have retinopathy. So ensure that you have your eyes checked up. Take care of your eyes. They are precious. Thank you all. Thanks for joining this lovely session. It has been a very nice interactive session. And thank you all, all the ophthalmologists. And this was a very nice interactive session. And it was a pleasure interacting with all of you as well as the audience. Thank you all.
Thank you, Dr.
Thank you. Thank you all.
Thank you.